Hong Kong is among the top 5 of the most densely populated countries worldwide. Still, official numbers only account for a handful of COVID-19 deaths. So what made the Hong Kong approach so successful? How did government contain the spread without a major lockdown? And what kind of smart technologies helped to mitigate the COVID-19 crisis? My guest in this week's Responsible Innovation story is Maria Cristhin Kuiper, a video journalist who is currently working at AFP News Agency in Hong Kong. Mrs. Kuiper, how did life in Hong Kong change during the last months?
The first biggest change was that everyone started to wear face masks, even when the government hadn't really imposed any restrictions yet. I think the citizens of Hong Kong had already started to impose, self-imposed restrictions. People started working from home and going out less. Of course, the SARS outbreak in 2003, I think, has much to do with that. People were already kind of prepared. They already knew how to react because they had dealt with something very similar already.
Did the government make use of any kind of smart technologies in Hong Kong for tracking and tracing people?
You would have to do a 14-day quarantine at home if you would come from any place overseas. And the way to check that is by this electronic wristband, which is connected to an app on your phone. Once the person gets home, they have a minute to walk around the apartment. So to determine the space of your apartment and where you can go.
Was there any kind of technology used also for tracking people who live in Hong Kong?
If it had been shown that you had been in contact with anyone who has the coronavirus, you would immediately be sent to a government facility to quarantine there, because that would mean you're a high-risk person, whereas the people who would quarantine at home were low-risk people. If you had the coronavirus, you would either be sent to a hospital or a government facility, and if you had been in close contact with someone, you would also be sent to a government facility. So no tracking there.
Could you give us an impression how such government facilities look like?
Yes, I did see some pictures of one of the rooms in a government facility. To be honest, it looks a bit empty. There's a bed, there's a table, but it's quite simple. So I can imagine that it can be quite difficult to stay there for 2 weeks.
You grew up in Europe, you know Europe quite well, and you now live for many years in Hong Kong. What differences do you see between Europe and Hong Kong regarding the reaction on the COVID-19 crisis?
People reacted here very, very fast because they had already gone through SARS, so it's not completely unknown. I think for people in Europe, there was a lot of debate on, the seriousness of COVID-19 and how people should react, whereas here in Hong Kong, at least, people knew immediately what to do. People were here even pushing the government to do more, for example, to close the borders with mainland China and not let anyone else, not let people from mainland China in Europe. People were quite concerned about their freedom, at least from what I've heard in the Netherlands. It was a bit more difficult for people to accept restrictions, whereas here it was a lot from people's own initiative.
Were there any kind of restrictions on events or on public gatherings?
Yes, so we've never had a complete lockdown in Hong Kong, that is correct. But we do have some social distancing measures, so we can only meet up with 4 people max. If you go to restaurants, for example, there needs to be space in between the tables. So there are certain tables that have like a big X on it, so you can't sit there. So that creates some space between them. Other restaurants have put some plastic barriers between tables so that you kind of separate it in that way from other people. Gyms have had to close. Also, some parks have been closed. Actually, the first thing that the government did was to close schools. Actually, before any other restriction, that was the first thing that they did. Also, civil servants were ordered to work from home for, I think, about a month.
Were there any kind of emergency plans which were quite operational, or was this kind of preparation which is more a mental awareness?
I think both. Both mentally, people were prepared. They knew how to act in such a situation. But also, the government set up an emergency plan quite fast. If you would ask people here in Hong Kong, why are there so few cases? Most people will say it's because the people themselves played a huge role.
What would be the main lessons learned for policymakers in Europe they could derive from the experiences in Hong Kong?
I think the main lesson is to act really fast because, as we have seen, the coronavirus spreads really fast. And I think perhaps it is better to react more aggressively in the beginning and to see how things develop then, rather than to wait. Another thing, I know that around the world there's been a big debate about face masks and how effective they are. If you look at Hong Kong, I think you can see that it has definitely played a role in helping to curb the spread of the coronavirus.
Thank you very much for taking the time. It's been very interesting to get some insights from the other end of the world. Thank you very much.
And thank you for inviting me.